Hello, everyone. Assalamu alaikum. Allahu Akbar. Namaste. Ha Samaya. Good afternoon, everyone. We are here to have a listening session with a number of different cultures and faith systems that we've not had previously. So tonight's session is called Building Vaccine Confidence Among Multicultural Communities and Multi-Faith Practices. And before I go forward, I'd just like to say that we have ASL interpretation tonight. So if anyone is in need, that is available to you. I also wanted to say that this is being streamed live, so everyone has access to that. Next, please. We'd start off by saying from Oregon Health Authority, we are acknowledging community. We acknowledge that there are institutional, systematic, and structural barriers that perpetuate inequity that have silenced the voices of communities over time. Next. We are committed to partnerships, co-creation, and co-ownership of solutions with communities disproportionately affected by health issues so that groups can actively participate in planning, implementing, and evaluating efforts to address the COVID response and other health issues. We recognize community-engaged health improvement is a long-term and adapting process. We are striving to engage with communities through deliberate, structured, emerging, and best practice processes. We are striving to make engagement with public health effective for communities, especially those communities that experience institutional, systemic, and structural barriers. Now we will have a tribal lands acknowledgement. We acknowledge that what we now call Portland, Oregon, and Multnomah County are the ancestral lands of the Multnomah, Wasco, Cathlamet, Clackamas, Cowlitz bands of Chinook, Tualatin, Kalapuya, Malawa, and many other tribes who have made their homes along the Columbia and Willamette rivers. We are here because this land was occupied and its traditional people were displaced by colonists and settlers. As settlers and/or guests, we recognize the strong and diverse Native communities in our region today, from tribes both local and distant, and offer respect and gratitude for their stewardship of these lands throughout the generations. Now we will pause a moment and have an opening prayer by Carla Rowe from the Baha'is of Portland.
Oh God, thank you for bringing us together tonight in unity as we strive to better meet the spiritual and material needs of our shared community. Our community faces many complex challenges during this devastating COVID pandemic. We ask for your guidance in our consultation tonight. Just, fair, and equitable solutions are sought for all. We turn to you as you are the healer in both this world and the world to come. And as the short Baha'i prayer states, is there any remover of difficulties save God? Say, praise be God, he is God. All are his servants and all abide by his bidding. Allahu Akbar.
Thank you so much, Carla. My name is Larry Hill. I'm a community engagement coordinator for the Oregon Health Authority. I will be your moderator on tonight. Now for introductions. I would like to introduce, as part of our panel, Imam Mohsin Al-Dalimi. He is the Imam of the Islamic Center of Portland. He's also the Imam of the Mahdi Center in Beaverton. We have Reverend Isai Ikanaga, representing the Nichiren Buddhist Temple of Oregon. We have Carla Rowe, representing the Baha'is of the greater Portland area. We have Brother Waji Saeed from the Muslim Educational Trust. We have Anandi Sarathi, who will be representing the Hindu community. And we have Dina Marshall from the congregation Neva Shalom, who will be representing the Jewish community. We thank them beforehand for representing their communities tonight. We know that we do not have all faith systems presented here tonight, but this will be the first in many interfaith activities that we support as part of this listening series. And we hope that we all will have a great environment for learning together. Next. So how we got here. Under the guidance and leadership of the Oregon Health Authority's Patrick Allen, Rachel Banks, Kara Biddlecombe, and Dolly Edwards, we're here to continue in our efforts to have an open dialogue with communities concerning COVID-19. So how we got here and how it's impacting our Oregon communities. Thus far, we've had a number of productive listening sessions led by Oregon Health Authority's Community Partner Outreach Program, and particularly Crystal Marion, Dr. Bakosi and Dr. Evans, and other faith leaders and community representatives from throughout our state. Tonight, we share our floor with faith leaders and representatives from faith systems which oftentimes don't have an equal platform or venue to discuss issues pertaining to public health. Tonight's focus will be on non-Christian faith systems, but we want everyone to know that all faith systems and all faith houses are welcome to listen and participate in tonight's session. This is not us against them type of situation, only our attempt to be more inclusive and equitable in getting messaging out to all Oregonians. Finally, we gathered tonight to address much of the COVID curiosity that many of us have regarding the virus, the various vaccines, and the implications that it may have on overall health outcomes for our communities. Our ultimate mission is to share information, increase COVID vaccine confidence, and prepare you as audience members to use that information to make decisions related to how you respond to COVID-19 as individuals in your familial or community settings. Next. So we will have an overview of how we're going to proceed tonight. So for tonight, we are going to have, again, a presentation by Dr. Bakosi and Dr. Evans that will last approximately 30 minutes. The panel will be able to ask clarifying questions during the presentation. The audience at large will not, only panel members will be able to do so. After that session, panel members will be able to ask questions directly to our medical advisors tonight. We will ask that they ask one question at a time, and I will moderate them as they go from one to another in asking these questions until all have asked two in total. If time allows, and we're hoping that it does, they have additional questions on hand in which they can ask our medical advisors. before the end of tonight, we hope to take some time to talk about some of our next steps, as well as share some of our current resources that are available to you all. So with that being said, we should move into our presentation with Dr. Bakosi. Dr. Bakosi.
Thank you very much. Thank you very much for the introduction, Larry. Just a quick correction. Bakosi is my first name. Dube is the last name. And no, I do not have an MPH, as the slides indicate. So thank you very much, everyone, for joining us this afternoon and evening. We'll be talking about the vaccines, how they were made, and we'll proceed to questions and a question and answer session thereafter. Oh, I don't have control over the slides, so if you could please, next slide. So the main objectives of the talk, we'll talk a little about how the vaccines were made. There is some information about who is in what phase and what phase we're currently in, and how the OHA came up with that, and then we'll end off with questions thereafter. Next slide, please. So this is for the media, just to say that this is not a session for the media. If the media would like to contact the OHA, and there is the email through which the formalized process goes by. So again, if there's media available, if media would like to connect with OHA, the email is there for everybody to do so. Next slide, please. So jumping right ahead, so the term COVID-19 comes from the fact that this is a coronavirus. The term corona is Latin for a crown. So it has these proteins on the virus that make it look like a crown, hence the name coronavirus. And it causes a respiratory illness, a disease that started, the pandemic started in 2019, hence the 19. Next slide, please. Currently, there are 3 vaccines available in the US. There are the two mRNA vaccines, the Pfizer and Moderna. And then there's a Janssen and Janssen, which is an adenovirus based vaccine. Next slide, please. I should state that there was a 4th vaccine that was potentially going to be made available. They applied for an EUA, but the federal government has decided not to make that available here in this country, which is the AstraZeneca. So if you're in the US, you're probably not going to encounter that as of for now. To speak a little about the EUA, emergency use authorization, what we learned from the HIV pandemic back in the 1980s was that after the antiretrovirals were made, it took a long time for these to become available to the general public, to people that were infected with HIV that needed the medications. And so and as a result, a lot of people died unnecessarily, and a lot of people were infected unnecessarily. So what we came up with was a system to ensure that drugs and therapies like vaccines are made available to the general public in a timely fashion in the event of a pandemic, and when we have enough safety data and effectiveness data to give them to the general public. And hence the government came up with, the FDA came up with this mechanism that's called an emergency use authorization. So it's essentially a way to ensure that when we have a therapy that's that can save lives and reduce the rate at which people suffer due to an illness. That therapy is made available in a timely fashion, and hence the EUA. Next slide, please. So, as stated previously, there are two main types of vaccines available in the US. The first two are the mRNA vaccines. These, I should take a step back and talk a little about what mRNA is. mRNA stands for messenger ribonucleic acid. So for the purposes of this talk, and just to simplify things, we'll say that there are three main RNAs. There's messenger RNA, transfer RNA, and ribosomal RNA. These have been around for as long as human beings have been around. They occur in RNA occurs in all living organisms. So viruses have this, bacteria have this, fish have this, monkeys have this, cats have this, lions have this, we have it as well. It's just a mechanism of making proteins. And with that, I'll also state that the way human beings make proteins, the way most organisms make proteins is that in our bodies, in our cells, we use, for simplicity's sake, we'll call it, it's called the central dogma. It's DNA makes RNA, which then makes proteins. I'll say that again because it's very, very important. DNA makes RNA, which then makes proteins. And in this RNA thing, where there are the three RNAs that we talked about, and the first one is called the messenger RNA, mRNA. So what scientists did is they figured out the proteins, the corona proteins, those spike proteins on the virus that give it the crown-like appearance. They figured out what those proteins are and worked backwards to the mRNA, the messenger RNA that makes these proteins, that provides a message to make these proteins. Once they did that, they isolated that mRNA and made a vehicle, a transportation mechanism to deliver it in the form of a vaccine. And that transportation mechanism is this cholesterol bubble, this fat bubble that they wrapped it in. And that's what you get when you're getting the vaccine, at least the mRNA vaccines. This technology is not new. We've been working on this technology for the last, I would say, 25 to 30 years. In vaccines and in cancer treatments, we've been working on this for the last 10 years. And that's part of the reason why they were able to come up with these vaccines so quickly. It's because we've been working on it for such a long time. Next slide, please. So of the two mRNA vaccines, the Pfizer and the Moderna vaccines, they're given in 2 doses. One is Pfizer is 21 days apart. The other one, Moderna, is 28 days apart. And they're all very, very, very effective. They have about 94 to 95% effectiveness in preventing illness and preventing transmission. What's important to note, though, what's not on this slide is that they have 100% effectiveness in preventing severe illness and hospitalization. I'll say that again because it's very, very important. It'll come up later on when we talk about comparing different vaccines. Both these vaccines have 100% effectiveness in preventing severe illness and hospitalization. So that's very important. Next slide, please. Switching gears to the Johnson & Johnson, also called Janssen vaccine. This uses a different mechanism. Remember I talked about the vehicle that's used to transport that genetic material in the vaccine. In the mRNA vaccines, it was the cholesterol envelope. in the Johnson & Johnson vaccine, they use an adenovirus, an inactivated adenovirus, a non-replicating adenovirus that's naturally occurring and doesn't cause any problems to us because it's deactivated. So they put in the genetic material in that virus, and that's what you get in the Johnson & Johnson vaccine. It works in a very, very similar way, except that in this case it has DNA, and then the DNA makes the RNA, which then makes the spike proteins, and then your body responds to these spike proteins that it's encountering by making antibodies. This is an older technology. It's been around for a long time. It's been used for different vaccines, as stated, it's older. It's tried more than the other two vaccines. Doesn't mean that it's better. It's just older. Next vaccine. Next slide, please. So, so the way vaccines work is that they, in this particular case, they work by taking the genetic material that you get in the vaccine and telling your body to make spike proteins, which look like the ones on the coronavirus. And then your body responds by making antibodies that protect you from the coronavirus. They do not in any way interact with your DNA. They do not in any way change your DNA. And as stated earlier, you are not getting a live vaccine, a live virus when you're getting these vaccines. There are other vaccines that are not available in the US that use a live attenuated vaccine, but we're not using those here in this particular case. So you're not getting a live virus in this case. Next slide, please. There's some more information if you'd like to learn more about this, about these vaccines. Next slide, please. So who were the participants of these in these trials? So of note, there were close to 110,000 people who participated in these trials. And the Pfizer vaccine was primarily done here in the US. Pfizer vaccine trials were primarily done here in the US. And they had 43,000 people. Of note, they had close to a little over 30% being people of color, people who identify as minorities, with 10% being Black. With the Moderna that was primarily done here in the US, and this for both these mRNA vaccines, they were done early on in the pandemic. So they were tried in an environment where they encountered only the original strain of the virus. There were about 30,000 people who participated in the Moderna trials, and also had similar numbers with about close to a little over 30%, 35% of people identifying as minorities. The Johnson & Johnson was tried all over the world, not all over the world, but in more countries, in South Africa, in Brazil, Central America, South America, and here in the US. They had 40,000 participants, and they had a lot of people who identified as minorities. So they had enough people that looked like you and I participating in all these trials, and they found that they were very effective and they were very safe. Hence, we're able to roll them out and give them to people confidently. Next slide, please. So I've touched on this briefly. talking about the effectiveness of these vaccines. So I'll just say that the thing that we care most about is preventing severe illness and preventing hospitalization. And both these vaccines were found to be 100% effective in that regard. Next slide, please. Same thing with the Johnson & Johnson vaccine. It was found to have 100% effectiveness against in preventing hospitalization and in preventing severe illness, which is what we care most about. And I'll talk a little bit about comparing vaccines and why that doesn't make any sense. But for now, I'll just say that it's in all three of these vaccines are incredibly effective. The major advantage of the Johnson & Johnson is just that it's a single shot. Next slide, please. So jumping right ahead to comparing these vaccines, it doesn't make sense to do this because the circumstances under which they were tried and tested were very, very different. So as a result, you are not comparing apples and apples. In this case, you are comparing apples and bananas, or apples and oranges, as the saying goes. So when people ask about which one is the better one, what I like to say is with the one that's offered to you, the one that's in your arm is the best vaccine for you. Next slide, please. The common side effects of the Moderna and the Pfizer vaccine. So there's the local reactions that occur from the injection. So soreness at the site of injection, you may get a little bit of redness, and then systemic side effects include fevers, muscle aches, fatigue, tiredness. All of this is an indication that the vaccine is actually working. It's doing what it's supposed to be doing. Next slide, please. And it's similar side effects with the Johnson & Johnson. The systemic, it has less systemic side effects. Next slide, please. Of note, there are no serious side effects that occur, as in there are no, and when I say serious, I mean dying from this or having a reaction where your throat closes down, you can't breathe, type of reactions. We have not experienced any of those just yet. There's a mechanism by which this is reported to the federal, to our monitoring bodies. It's called the VERS system. And so this will be monitored continuously. For as long as vaccines are being given, there will be a reporting mechanism to monitor these side effects. Next slide, please. So I'm sure you've heard about the new variants. What's important to note is that new variants come about when we have a lot of virus in the general population. So the more virus there is in the general population, the higher the chances that the virus will mutate and form new variants. So mutations are a natural thing that occur in viruses. When viruses make copies of themselves, they make mistakes every now and then. That's essentially what a mutation is. So you can imagine copying something by hand. If you had to write something by hand, I will not talk while in class. I will not talk while in class, taking me back to my 7th grade. So if you had to write that maybe 100 times, you may make 1 or 2 errors, right? You're going to make a few errors, and that's what leads to the variants coming into being. That's what mutation essentially is. So what's important to note, our current vaccines work against these mutations. So you should still get them. The other thing that I want to talk about is people who are immunocompromised should still take the vaccines because it's they will mount a response that may not be as robust as people who have normal immune systems, but it's still good enough to fight off the virus.
Dr. DeBay,
Yes.
one of our panel members has a question from some of the things you were just presenting. So Carla asked the question, as there are new variants of COVID-19 as they occur, how is the effectiveness of the vaccines impacted?
So thank you very much for that question. It's a very important question. Currently, we don't have, the data that we have is that our vaccines work against these new variants. That's the data that we have currently.
And I can probably just add one more thing to what Dr. Dubé was saying, is that, you know, specifically for the J&J vaccine, that was actually tested against the South African variant. I mean, in South Africa is one of the sites that actually had the vaccine deployed. So we know that it has some effectiveness there too. So.
Thank you.
Okay, next slide, please. So I want to talk a little about the things that we're hearing. I was born and raised in Zimbabwe. I came here after high school. And what I belong to a few chat groups on WhatsApp from my family back in my family, extended family all over the world. And some of my classmates from high school who are all over the world. And I see a lot of vaccine lack of confidence, vaccine hesitancy, and a lot of misinformation that's out there. And in talking to the community, we've been engaging the community the last 3 or so months. There are certain questions that come up over and over again. So we've tried to create a way to address those things from the get-go so that that information is available to as many people as possible. So I call this part of the talk setting the record straight. So do these vaccines have microchips in them? And will the government track you? Absolutely not. The vaccines do not have a microchip. We don't have that technology as yet. And all they do is give your body genetic material that makes proteins that enable your body to make antibodies. So no chips, no tracking. Can I get the COVID-19 from the vaccines? As stated earlier, we do not have live attenuated vaccines in this country. And I don't think any will be approved by the FDA during this pandemic because the 3 that we have are working so well right now. So no, you cannot get COVID-19 from the vaccines. Do these vaccines have a fetal tissue in them? There is no fetal tissue in any of these vaccines. So of note, there has been talk, I listened to a talk of the Catholic bishops not too long ago, talking about how the Johnson & Johnson vaccines were made and the fetal cell lines that were used in the development of these vaccines, these are stem cells that were obtained from it's an old cell line from, I believe, 1974. It's a kidney cell line that was used in the development of the Johnson & Johnson vaccines. But the vaccines themselves do not contain any fetal material. Next slide, please. Can someone still carry and transmit COVID-19? What we know is that vaccines prevent carrying viruses, carrying whatever it is that the vaccine works against, and transmitting these diseases. We don't have enough data yet to definitively say no, this does not happen. However, I will say that last week we had an opportunity to speak with Dr. Corbett, who is the inventor of the vehicle for the Moderna vaccine, and she essentially said, no, you cannot carry and transmit the COVID-19 after getting vaccinated. As you can see on the slide there is data coming out from Israel showing that after you get vaccinated, you have less viral particles, and which significantly decreases your chance of transmitting this disease. Next slide, please. I touched on this earlier when I was talking about how proteins are made in the body. These vaccines do not alter your DNA. They do not change your DNA, and they are safe. Next slide, please. Currently, so looking at long-term safety concerns from the vaccines, these vaccines were developed last summer, and they've been studied ever since. So we don't have any long-term data regarding these vaccines. However, what we can say and what we know for sure is that there shouldn't be any long-term there shouldn't be any long-term side effects, because once your body takes this genetic material and makes the proteins, it's destroyed. So it's no longer in your system. It gets denatured the same way. It gets destroyed the same way that other material that the body doesn't need gets destroyed. Next slide, please. If you have had COVID-19, you should still get the vaccines. It's something that we strongly encourage, because and you should get the vaccine after you've served your 10-day isolation period, because the vaccines are effective against other variants, whereas the one illness that you get from a particular virus may not provide the same immunity against other variants.
Dr. Dubey?
Yes.
We have another question from panelists about safety concerns.
Yes.
And the question reads, we have heard a few anecdotal accounts of people suffering from organ failure after receiving a vaccine. What is the incidence of this?
So I can tell you that there's been 0 cases of organ failure following vaccination. People may get organ failure and die from other things, but not from these vaccines. There hasn't been a single case that has been linked to these vaccines.
Thank you.
Next slide, please. So when we talk about sequencing, vaccine sequencing in this particular case, we're talking about who gets the vaccine and when they get it. And a lot of this has to do with how OHA and the governor's office have decided to prioritize certain groups. As you probably saw early on, the vaccine was initially given to frontline workers, people working in hospitals and clinics, and then we continued as more and more vaccines became available. We continued to expand that. Next slide, please. This is essentially how the groups have worked. I know this is a very busy slide, but this just details how people are prioritized and which group is going to have access to the vaccines. What I would like to let everybody know is that by May 1st, everybody should be eligible for the vaccine. Next slide, please. Some information for you on where to get the vaccine. Larry will provide more information as needed. I think that is the end of the talk.
Thank you so much, Dr. Dubé. There's yet another question from the panel. The question is, will vaccines booster shots be required soon, or will this likely become a yearly or more routine vaccine in the future?
Maybe let me answer this. So we know that from sort of even like natural immunity after someone gets COVID, you have antibodies that may hang around, and even from natural immunity may last for probably up to, maybe 6 months. So we know that these vaccines may not necessarily have sort of, lifelong immunity, like, you get your MMR shot, you can just get it once and forget it. This may need to be boosted. The second thing we also know is that, there are variants circulating out there. And when the mRNA vaccines were developed, they were developed against, I would say, sort of the original strain of COVID. And, now we have multiple variants circulating out there in different places. And so, there may need to be sort of re-updating of these mRNA vaccines. And I know some of the companies are looking at adding some of the strains, as Dr. Dubé talked about, this spike protein, sort of updating this mRNA spike protein in their mRNA vaccine. So we don't know sort of what that might look like or what timetable that might look like, but it is reasonable to think that in a few months we may think about sort of how people may need to get revaccinated or reboosted or so forth. But again, more of that is yet to come. So.
Thank you, Dr. Evans. Yet another question from the panel. Are the vaccine sprays coming up in other countries considered in the US?
Sorry, Larry, I didn't quite get what you said. May you please repeat the question?
Yeah, I'm reading it as it's written. It says, are the vaccine sprays, apparently there's vaccine sprays, which are present and available in other countries. Are those being considered in the US? So have either of you heard of those nasal sprays for COVID?
No, I have not heard of any of those. And I don't think there are any nasal sprays currently available. So there are currently only 3 types of vaccines available worldwide. There is the mRNA vaccines, then there is the adenovirus vaccines, and then the third type is the live attenuated vaccines, which is what the Sinopharm and the Sputnik vaccines, which China and Russia made. So I have not heard of a single spray vaccine, a nasal spray vaccine.
Okay, thank you so much. Okay, so at this point, unless Dr. Evans, unless you want to add on to the presentation thus far, if not, we'll go into questions from panel members. And so the order of the questions will be as follows. We will have Imam Mohsen Al-Dalimi be the first panelist who asks a question, followed by Reverend Isai Ikanaga, followed by Carla Rowe, followed by Wajdi Saeed, followed by Anandi Sarathi, followed by Dina Marshall. Okay? All right, Imam Mohsen, if you would like to ask your first question, please.
One of the questions I sent to you earlier, Larry, regarding very soon in 2 weeks, we will start our fasting month. And traditionally, we have a gathering to break fast as a communal break and fast. Usually we do that in our community center. The question is how safe to allow people who haven't had their vaccine yet to join such gathering.
So the best way to do this is follow the guidance, the county guidance for whatever county you're in. The indoor county guidance, they have limitations as to how many people you can have in one gathering space. What I would strongly encourage you to do is, as you break fast, have people of the same household stay together and ensure that there's adequate physical distancing. People who are vaccinated and those who are unvaccinated should be welcome to participate in these services, as long as you ensure that there's physical distancing and you stay within the county maximum capacity guidance.
Okay. We're thinking of allowing only the people who are already vaccinated to come, and the rest of the community can join virtually, through the online to participate in this gathering. Do you think that more safely as, precaution to take?
I really love your public health mindedness. This is beautiful. That would be the safest thing to do. Yes. So I strongly endorse that, strongly encourage that.
And Iman, I just wanted to add one thing, just to give you a timetable of what that looks like. If we estimate that most people have some amount of protective immunity within 2 weeks of their vaccine. And so, when you sort of thinking about who has that level of protection, it's sort of, I got my vaccine 2 weeks ago, not necessarily someone who got their vaccine yesterday, just to kind of give context also. So, sorry.
And I guess that with the same concept, the next question, most of our members of our community, as you know, we have many young families and they have children. And the question kept coming up whether they would allow their children to go back to school or would be safer to keep them home, which is hard to give really clear advice.
Yeah. So that's a very good question. I have 2 kids and my kids are back in school. I can tell you that the data that we have seen from places that opened schools earlier and practiced good protective COVID behaviors did very well. There was not much transmission in schools. So schools are actually very, very, very safe places. Where kids typically get infected is outside of schools, where there isn't as much physical distancing and masking and appropriate hand washing.
That's true. Thank
So
you.
please send the kids back to school. They need that interaction.
That's true. Yeah. Thank you.
Thank you for your answers. And I'm going to say mine soon because I need some sanity. Next panel member, please. Reverend Asai, are you there?
Hello. Can you hear me?
Yes.
Oh, hi. My name is Reverend Ikinaga. On your screen, I don't know, you just have OHMYR. I don't know why. Sorry about that. I don't know where that came from, but yeah. I'm sorry. I had all this time I've been trying to fool around with my audio. I could not hear you very well, and I'm still not hearing you very well. The sound is very soft, and I all this time I've been trying to fool you around. So you wanted, did you say you wanted questions? Is this, no?
As we had spoken previously, we were asking that you submit a question from your community, from your that would be consistent with what you're hearing in terms of trend questions, things people are most concerned with. Just wanting to see if you wanted to gain some insight from the medical advisors on hand.
Okay, so I'm very sorry. Because I couldn't hear you very well. So you need the questions now, is that correct?
Yes, if possible, if you formulated questions, that would be wonderful.
Actually, my people have been very receptive to the vaccination, and they are not very afraid of the possibility that the vaccines are not safe. Rather, the biggest problem is at the moment, I think, is trying to get appointments for the vaccination, and that seems to be the greatest problem. And your offices have been very helpful. The county, Multnomah County, has been, and I have been in contact with uh, the people, I guess, in charge of the vaccination process, and they have helped me immensely in getting some of these appointments for them. Aside from that, I think there might be not necessary problems, but I think it could be clearer for them. And because they asked me, and I have a hard time trying to find out, is maybe it's the messaging, in terms of who, which groups. I know right now it's 65 and over, and you have people younger than that, but they need to have some kind of medical issue, if I'm not mistaken. And yeah, that's where we are right now. But I think people are still unsure. I mean, I'm sure you are familiar with, how to get the information, and where you can find it. Um, I think a lot of people, I guess older people who may not have access to the internet and so forth, are not really uh, given the opportunity to easily get that information. Maybe, I don't know, even some places like supermarkets, that sort of thing. If you could maybe like put up posters saying, okay, we're in this vaccination period right now. So if you are within this age bracket, and well, if you have, this kind of medical condition, then we are, vaccinating you right now. Uh, and I know, I think maybe the county is doing as much as possible, but still for some people, it's like, it's very difficult, to readily get that information. At the moment, that's where I'm at. As far as the vaccination, the fear of the vaccination, it for our community, it's really not. I don't think it's not a very big issue, and everybody wants to get it, but are not able to. So that is the situation at the moment. I'm sorry, it's not really a question, but
Thank you, Reverend Ikenaga. We appreciate your input and suggestions. I'm going to ask Dolly England, do you want to weigh in on anything which was just said?
Hi, I'm Dolly England. I am the Community Engagement Program Manager, and I would say we are definitely working on a lot of those outreach strategies that you've mentioned. And we'd love to further engage with all of you on outreach materials and information that would work specifically for your communities. And I think that's the important thing that OHA can do to support you. But I definitely want to make sure you get the vaccine information. So we will be sure to look at our OHA webpage, which definitely has the vaccine tool that lets you know where the locations are near you, and that might be a resource. Some of those other access issues around accessing vaccine, I think this is where our faith communities are able to help us maybe get some appointments to your specific community members. And so we're interested in exploring those relationships, because that to me seems like the easiest way to eliminate barriers is to work with you directly to help vaccinate your communities. So let's continue these relationships and these conversations so we can get that information to you and vice versa, and make sure we're reaching every community member.
Thank you, Dolly. Next panel member, Carla Rowe.
Thank you. I think that, the question, I want to frame it a little bit, is that in the Portland metro area, the Baha'i community, our members are incredibly diverse from all walks of life, all cultural backgrounds. We have a lot of different languages spoken. And so when you start to really look at that population, the questions that I'd like to pose tonight are really related to how to work with these folks with very different needs related to particularly language. We'll start with language, and then I have one other population. But when you look at the language, the ability to have an interpreter available by phone, I don't know if there is one. If there is a line where multiple languages can be spoken, that they could actually have an interpreter help them make that decision and actually help them make an appointment, because with that language barrier, it's sometimes hard to get the information that's needed. And then once they've got that, then I think the question is, what about when they get to the site? Are there actually interpreters available at some of these sites who can assist? Are some sites better than other if you need that type of help? So I will also, since Dr. Dubé, you put up a slide at the end, which listed a number of resources. If we click on those links and go there, do they actually come in multiple languages? If we can get computer access to those folks who speak different languages, and you click on those links, is there a language that we can click on that as an option so they can get the information they need? I'll pause there.
You bring up some very, very, very important questions, right? What good is the medical system if people can't access it in their preferred language, in the language that they can understand? So with regards to languages, I can tell you that at most clinics, if not all, have interpreters available, either by phone, video, and before the pandemic, we had live interpreters. Now we're shifting back to allowing those interpreters to come back once they've been vaccinated. So that service is now available. If you go to, so I work at a mid-county clinic that's part-time, and what I have seen there happen is when patients show up and they show up to get vaccinated, there are interpreters available by phone to translate for them. So that effort is ongoing, and I know for a fact, being a speaker of multiple languages, it's never the same when you're talking to somebody on the phone and somebody's translating, and it's not the same as having somebody there. So we're working towards having better interpreter services.
It's my understanding from many of the large systems, like the larger systems that have healthcare through them, they actually do not do clinic calls anymore about vaccines. They go through everybody gets redirected to go through the major lines that are available through Oregon Public Health. And so when you're looking at making an appointment, you no longer can do that through your clinics. So it's an interesting problem, I think. And if we direct people to local pharmacies and things, or places that might be having vaccines at Walgreens, there's not interpreters there to help with that. So
that's good. So yesterday we had a large vaccine event in North Portland for BIPOC communities, put on by OHSU. And we really tried to get a diverse workforce from OHSU out there. So we had people speaking French, Spanish, and so forth. But of course, there are many languages that were not going to be represented. And for those folks that came to the vaccine site, they actually just had a little mobile phone. And as Dr. DeBay said, it's not the same thing, but there was someone basically with a mobile phone that was given to them that basically transitioned from asking the questions about, eligibility for the vaccine, going to registration, somebody just held their phone and then getting their vaccine, and then they stayed with that phone until the end of their vaccine event. And it's not the best system, but for the few folks that I saw doing that yesterday, it seemed to work, but it needs to be improved. So
thank you for sharing that, because I don't know if that service is available at the large drive-throughs like, the airport or at the convention center. I didn't see evidence of that, but I don't know that for sure. So thank you for looking into that. And then the final question I had about that particular question was the links. If you go to those links, are they in multiple languages?
Yes. So getvaccinated.oregon.gov is in 10 languages. So it's not sufficient. We know that there are more than 10 languages in the Portland Metro, but it's a start. And then you can also use the phone, the 211. If you dial 211, you can schedule your appointment that way through an interpreter. So that's available as well.
Okay, and then my final question had to do, if you take a look at there's some resources available for different people, but those who are homebound, those people who really are sick at home, how can they get a vaccine if they really are at home? And they're for both them and their caregivers. Some people can't sit in a wheelchair or get out there. But they have people coming into their home. So they need the vaccine, but how do they get one?
So we have mobile vaccine clinics that are going to different people's homes. I actually have a friend of mine who is a former senior health advisor with the Oregon Health Authority, who is doing this. She's a physician by training, and she's running a mobile vaccine clinic and going to different homes and vaccinating people and their caregivers. So thank you very much for that question. And there is a concerted effort to ensure that we reach that population.
And how do they reach that resource? Is it through the...
I wish I knew. The best way to do that is to contact your LPHA, your local public health authority. So if you live in Multnomah County, you call Multnomah County Health Department. They will schedule that appointment for you. I don't know if Larry or Dolly may have, or Dr. Evans may have more information about that.
What I was going to say is that for any of the questions which are posed that are not answered here, all panel members will do research. We'll make sure we get those resources out to them. And then based on this call, because we recognize that others are listening online also, we'll make resources available, if not tonight, after the fact, so that people can access them and make those available to them. We appreciate the ask, because the ask help us then to better serve those in our communities.
Thank you.
Okay, so next up, it doesn't look as though we have Brother Wajdi here tonight, and so I am going to move us to Anandi, if you would.
Hi, thank you. Yeah, this was a great information session. So my question is about masks. I know this vaccination and making it available to everybody in my community, we're all happy and, like they said, waiting for our turn. It's good we have vaccines, but given, I think, below 16, there's no vaccine yet, or and in the world, there have been places, Singapore and Hong Kong and China, who have managed this virus more effectively using masks. Given all this, what is the suggestion or the direction once majority of the population gets vaccination for masks?
So thank you very much for the question. Yes, there have been places that have managed this much better than we have, for for one reason or another. So the thing that we notice, the thing that we've learned from these places is that they have been able to institute total lockdowns, which we have not done in this country. We have also been able to see that practicing good public health preventative behaviors, masking, good hand hygiene, physical distancing, those things really work. And they reduce the spread of the virus. They reduce the number of people getting sick and the number of people dying. Making masks available to
Dr. DeBay, I'm wondering if it's just me, but it seems
back
though
to
you've
vaccines.
Yeah.
That suffice.
Dr. DeBay, can you go back and repeat what you just said? I think you froze for a moment.
Oh, yeah, it says my internet is unstable. Sorry.
No problem.
Can you hear me now?
Yes.
Yes.
So I don't know where the last thing that you heard, but I was going to jump back to vaccines and say that with vaccines, there's only one vaccine that's currently available to 16 and older, which is the Pfizer vaccine. The study is going on right now, countrywide, actually worldwide, looking to see if kids can get these vaccines. We should have enough data, I would say in the next 2, 3, maybe 4 months at the latest, to see whether or not kids can get these vaccines. I know that, I'm not sure, maybe Dr. Evans knows, I'm not sure if there's one, if OHSU is one of those centers that's running these studies.
No, the only study that we had was the AstraZeneca study right now. So no, we're not that we're, yeah. Not the studies now.
And then lastly, you talked about masks, making masks available to kids. Yes, these are available. If there's no child who should not be able to participate, who won't be able to participate in activities because they don't have a mask. So if they go to school, they don't have a mask, the school is supposed to provide those masks. And the OHA is providing masks to schools. And the federal government is providing masks to schools as well to ensure that kids have masks and to ensure that they can get the services that they need.
Okay, thank you.
Okay, let's move on to Dina.
Hello, thank you. This is really wonderful, and I really appreciate the chance to join you all. And looking through my questions for tonight, I realize I only have one decent question, and we're really short on time. So I thought first maybe I would kind of share with you some perspectives from the Jewish community about sort of how we're sort of seeing things take shape in Oregon. I apologize for the background noise. They're working on my kitchen. So first of all, I think Carla, you mentioned that the messaging could be better, or maybe Larry, you said the messaging could be better. And I think from our perspective in the Jewish community, we're in complete and total agreement on that it would be really wonderful to see sort of, oh no, actually it was Reverend Ikenaga who said, if we could see signs or something, posters at supermarkets or in our face all the time, who is eligible at this time, today, right now, and how do you sign up, and hurry up and go get your vaccine, that kind of like in your face all the time, get with the program messaging, I think would be very helpful, especially in our Jewish community. There's a very, very strong support, almost a requirement to get vaccinated when it's available. And it's along the lines of preserving life. And then the question of whether a vaccine is derived from stem cells or human cells, it doesn't matter, because the priority of saving a life is so much more important than sort of wondering where that vaccine, that life-saving vaccine came from. I think really takes priority. And then having masks available is huge. We have, whenever we get a delivery of masks, they are distributed almost immediately. And what we've seen is that the KN95, well, first it was the N95 masks that everybody wanted. And then it was the KN95 masks. And then there was a question about whether certain KN95 masks sort of sparked an allergic reaction or not. But we found that the cloth masks that are being delivered through the federal government are not quite as popular as the KN95 masks. And also that people are wanting to wear them more often than just once. They're not a once use, a single use kind of mask. And we're also hearing a lot of interest in non-injection vaccines. So AstraZeneca is trying this nasal spray, and I read an article about a tablet maybe that might be in the works in other countries. And I think that there really would be a lot of interest if that option were available. And for parents, will definitely want it for their kids, for sure. So my question really for you is, and I'll sort of frame it in terms of this Jewish concept of bal tahit, which means unnecessary waste. And so we have sort of there's a concern in Judaism about wasting things. And even some rabbis have encouraged people to sign up for leftover vaccines whenever it's feasible, so the vaccines don't go to waste. And we're hearing a lot of interest from people wanting to just get a leftover vaccine whenever it's available, if they qualify or if they don't qualify. But how do you find one? So that's a real question that right now that I'm hearing a lot of. And I'll just very quickly look over my list and see if there might be anything else I could tack on there before we run out of time. I think that's really the big question about, how can people get even a leftover vaccine when it's available?
I can answer just from yesterday. So we had again big vaccine event on Sunday and Monday. And, inevitably, anytime anyone shows up, because we had our folks that were registered, people bring their mom and dad. People like, hey, I signed up my dad, but can my mom get a vaccine? And, it's hard to turn away families, because when you talk about public health, it's about a community. You can't just say, I'm just going to vaccinate mom, I'm not going to vaccinate dad. And so what we did, just to be equitable to everyone, is that we kept a list. And we said, hey, give us your cell phone number and we'll call you back. And, we had, a 17% no-show. And what we started doing maybe about 2 or 3 hours before the event was over is that we started calling people and saying, hey, we think we'll have vaccines available. Can you come in? And by the time we ended, every single dose of vaccine was used, which made me feel good, because I agree with you. It's horrible to think that there are people out there who are just so nervous having to see their families, and we're wasting such a valuable resource. And so I completely agree with you. So I think having these phone lists at these big vaccine events, I know they're doing that at the airport also, that if they have leftover vaccines, they're keeping an active wait list, and they will reach out to folks to be able to get them in so that no vaccine is wasted, because I agree with you, that's an important thing.
Well, Dr. Dubé or Dr. Evans, can you speak to that issue with respect to leftover vaccines? I mean, if they're left over, they cannot be used again. Can you expand upon that?
Yes, so hence what Dr. Evans described. It's actually, and I thank you very much, Rabbi, for sharing that. It's very, very important that these vaccines get used after they've been opened, after they've been shipped, delivered, and thawed, and they have to be used within a certain period of time. And so I've seen this happen. My neighbors, I have a neighbor who's in the 50s. She walked over to, she was at Safeway, and they were doing a vaccine clinic, and it was at the very end of the clinic, and they put out a PSA on their speakers. We have extra doses of vaccines. Is someone willing to come and get vaccinated? And she went and got that's how she got a vaccine. And so I love hearing stories of how we're public health minded, and you also touched on something that's very near and dear to me, which is the principle of double effect, where some harm can be done, but that's not the intended thing, and then you have a good that comes out of that. The good does not become less of a good because a harm was done previously. So thank you for highlighting that. Again, the vaccines have to be used after a certain period of time after they've been shipped and opened.
I'll share a story. I had people in my neighborhood actually who wanted to get vaccinated. They were right on the line of being up next, but we have a local pharmacy that I recognize weren't fully successful at vaccinating everyone. I mean, not utilizing all that they had. And so I kept telling them, go over there, get on the waiting list. And that in fact happened. They got vaccinated because there were extra vaccines at the end of the day. So it would behoove those in the audience to take advantage of that, because again, the better we get vaccinated, the less we'll be having more of these types of conversations. I have a question. I'm wondering if any of the panel members have been vaccinated at this point. And if they have, would you speak to that in terms of what that has allowed you in terms of comfort, a sense of protection, and maybe some other things that maybe you hadn't experienced previously as a result of not being vaccinated?
I did get my vaccine, both doses. Same thing for my wife, and that gave me really kind of more relief to be in more touch with our members of our community when I do our mid-Friday prayer service and some other activities. I've been encouraging our members in every Friday service, please find out when you can get it. And actually some members managed to get it even outside their county, which is good news. I mean, they are still not included in the age group, but they managed to get it in somewhere else within the state, which is nice.
I also had both of them and out about 3 weeks. Now, I will tell you personally, the highlight for me is that my grandchildren live farther away. So as soon as I was fully vaccinated, my oldest grandson and his wife flew in, and I got actual hugs, real live people contact with my family, which I absolutely valued. They had their masks, but at least we could see each other. It felt safer. And I noticed that in my area where I live, a lot of people are on the verge of either they've got their second one or there's, they're around. Their families are being really great about masking. And you see a few more people out, and that conversation and the social contact and being able to be real time talking to someone. Yes, we're socially distanced, but it is so nice to see that happening. So it was really just a huge relief to get that done.
Dina, I think you had your hand up also.
Yes, like you, I also got both of my my vaccines, and I'm really feeling this big opening up with my friends and family. My relatives are all very far away on the other side of the country, so I haven't had a chance to really hug them yet. But I did get a hug from a friend not too long ago, and it felt wonderful, really did. I have to say though, I did have some of that vaccine guilt. It exists, it really, really does. And I remember standing in line in one of the first groups of eligible people and thinking, if I could give it away, who would I give it to? And I was, and as I was thinking that out loud to the person next to me, I watched someone who didn't look anything like me walk in and ask for a vaccine, and the people explained to him that he didn't qualify and couldn't get a vaccine that day. And I thought, you know what, I would give it to him. That's the person I would give it to. And there's a little bit of jealousy. I think you come back to staff and you know talk to the folks at work, and they say, well, how did you get ahead of how did you jump the line? And there's some of that happening for sure. I don't think we should minimize it, and know that we're all sort of in this together. Every person who gets vaccinated is sort of one more step toward the whole, but it's still there's still an imbalance for sure.
Well, we ask you to continue to share your stories because, as you know, as we started off, there's still a lot of vaccine curiosity. Certainly, as we try to build vaccine confidence, I think your individual stories help people to, again, make considerations on their own individual status and how they might want to pursue the vaccine. I myself have been vaccinated. My wife is at risk based on 4 prior times of breast cancer, and also being a medical director at her clinic. She's exposed to patients on a daily basis. And so since I'm there also, I have to get vaccinated. And I will say, it's brought me a sense of comfort and confidence. And at the same time, I can share with persons who look like me that the side effects were minimal and that the peace of mind is great. And I too look forward to hugging family members. We have approximately 7 minutes left. I'm going to ask panel members if they have anything to leave us with in terms of other points that they would like to ask, or maybe sharings that they would like to bring forth. I'm going to give them an opportunity to do so. You just raise your hand or unmute yourself. Please share.
If I may, please, because with my experience, actually, since I've been vaccinated and been calling for our community members to get vaccinated, I consider that a very positive influence in the community, because unfortunately, most of our people, through their own language and social media, there is a lot of misinformation and disinformation, as Dr. Okosi mentioned to it. So as an example, telling them if your imam got the vaccine, you have to go and get it. Otherwise, you will not be allowed. And actually, that's helped a lot to relieve the hesitation and the questioning and the fear of whether I should take it or not. Because again, unfortunately, in the Facebook, there are so terrible things some people telling and saying about the vaccine. And most of people really, they don't have that much medical background or general education to really being able to defend it. It was particular when they said, well, for instance, why the government immune the Pfizer or Moderna from any responsibility for being giving the, which is different issue totally, but some people misuse it to discourage people. Yeah, thank you.
Thank you for your shares, and thank you for getting the word out in the community so that people can make informed choices with regard to their own individual decisions. Any additional input, Dina? Yes?
Just last one, from the team that I manage, is the COVID outreach team. I think we really also see this as an opportunity to build bridges. We're working very closely with another faith-based organization to host an interfaith food drive that will to bring in halal and kosher foods, and then to go from there and jointly host a vaccination event. And then from there, we hope in the fall to jointly host a communal meal. And so we really see this as sort of part of a much bigger picture. I hope it grows from there.
That's beautiful. Carla.
I would just like to follow up on something Dina said, because in the Baha'i faith, the concept of service, work that you do in the spirit of service is equal to worship. And so there's a real concern about how could we get connected with who might need our help. If we wanted to host a vaccination clinic, how do we find out who to call to offer that service or that space?
So I'm just going to say, call the Oregon Health Authority at this point. We're trying to convene opportunities for some of our community partners to help support these stand-up vaccine efforts, and we can give you additional information. I see Dolly's popped on. Dolly, let me let you give your official plug, and I'll stand back.
We are working hard on this right now. And so Britt, I believe, has some slides that he'll pull up to kind of wrap us up here, but we have information. The biggest thing would be to contact us at the Oregon Health Authority, and we will do our very best to match you with someone who can assist with getting vaccine. There are a number of ways. Larry is here. You have Larry's contact information. For the panelists on here, we will get you connected. There are a lot of people working really hard right now to figure out how do we partner with many communities across the state to make sure that folks have access to vaccine. And we really need to do it in places that they trust and respect. And I can't think of a better place than in their house of worship. So with that being said, please do reach out to Larry on this, for those of you on this line. And for everyone else, Britt is sharing the information around our COVID-19 vaccine website. And this will just get you the information of where do I go. But for those interested in hosting, we will work with you and get you connected. We don't have all the answers, but we are figuring it out.
So with that being said, I'm wondering if the good doctors would lead us into the next steps, or Dolly, if you want to do so, or you want me to take a stab at it. How will we, that's not actually a good thing to say. To me, how would we like to end this? How are we going to proceed from here?
I think, didn't you ask someone to give a blessing at the end?
I am. I will say this. With tonight, we had an opportunity to all come together. We have had a number of offerings from different faith systems. We truly appreciate your input. We look forward to this type of collaborative effort as we move forward. I think what we found tonight is there's a lot of commonality among those who were present, and we look to build upon that as we continue to address issues of vaccine curiosity and build our confidence around vaccines in our state. And as we leave tonight, I want us to remember the resources that are made available. If you do not remember firsthand, hopefully you have my contact information. I can send you onward to the appropriate places. Again, thank you for taking the time tonight to participate in this process. We thank panel members. We definitely thank Dr. DeBay, who had to put up with me messing up his name, and also Dr. Evans. Hopefully I didn't mess up your name. This has been a wonderful night, and I'm going to let Imam Mohsin, again, I'm sorry I'm gonna work on it so that at one point it's gonna be very, very comfortable. I would love for you to end this segment with a prayer.
Okay. Actually, this is kind of more reflection rather than just a prayer. We have a traditional saying stated that God created a cure or medicine for every illness. And that's one of the essential concepts, as Ms. Marshall stated, of preserving life. So no matter how we are dealing with this pandemic, and it give us a scare and afraid and shake us to really, we haven't met such a things, but we have really as a member of the faith community to encourage our members and communities to reflect it in the importance and necessities and the obligation for self-preserving. And this is why the prayer I would like to end with says something like that. Oh God, make my life and bounty of every goodness in it for me and for my fellow human beings. So we hope with this spirit and our commitment to fight this pandemic, to be able to spread the good words for our members to defeat this and to, as we say, God willing, to getting in the higher status of health. Thank you, everyone. Excuse me, Larry, if a couple of these slides are really nicely to indicate how people can get scheduled for vaccine. If you would please can email them some of the presentation, I would like to send them to our community through our mailing list.
Yes, we will give panel members a variety of different resources in addition to what was presented tonight. We'll make sure that it gets disseminated out, and then also ask that you call anytime that you have questions that we might be able to support either in our program or with some of our other community partners, be that community-based organizations or our local health department.
Thank you. And really, I would like to hear, as Carla stated, that if we are able to offer our facilities, because our location and a place is big for allowing to be used as a clinic for offering vaccine. As you know, because some restrictions, some of our women's, they have to be covered, and we could offer that. That's what we've been done with the blood drive, where many women could come and feel comfortable in their secluded area to donate blood. So we could offer that as well for women to come and have their vaccine. If that could be arranged, that would be great.
Let's keep these lines of dialogue open. We welcome you all to do so. Before we leave though, I think let's take some extra time to thank our ASL interpreters, Madison and Sarah, for tonight. Thank you so much for your support throughout tonight. And with that, I'm going to ask that you all have a wonderful evening. Thank you for your time of sharing, and we'll look forward to you all out in the field, making new friends and new alliances as we continue to reduce this pandemic in our state and within our world. Have a great night.
Thank you. Thank you.
Very much.
Thank you, everyone.